we are being asked if immunosuppression affects gut health, which in turn affects overall health and the development of other illnesses.
Well, yes, of course. Yes, of course. Immunosuppressive are very important treatment after liver transplantation. And I remember you that in the first area of liver transplantation, when they didn't have immunosuppression, patient died in 2 or 3 or 4 days after. So now you can survive after liver transplantation because we have those treatments, but the problem is that you can have secondary effects, so you have to deal with that.
I remember when I left hospital, I was very, very strict with myself. I was told to have a small portion of butter, buy small cartons of milk, everything had to be pasteurized, well cooked, peeling vegetables, and I was really quite paranoid about what I was eating. I've always eaten quite healthily because my mother instilled that in me, but I came to realize that, in fact, as a transplanted person, you should eat a bit like a pregnant lady.